For people recently diagnosed with the HIV virus, AIDS, the first walk down a hospital corridor can be a lonely and frightening experience. Fortunately, through the accomplishments of the AIDS Healthcare Foundation, there is help for those in need. AHF is comprised of professionals and volunteers dedicated to one common goal: treatment and hospice care for persons living with AIDS.
Chris and I were the founders of the original group called the LA AIDS Hospice Committee, which basically fought to put the focus on the care of people with AIDS, people with HIV. At that time, there was a lot of emphasis being given to research and to education. We were looking for the magic bullet that was going to rid us of AIDS. And we weren't paying a lot of attention at that time to how we were going to care for the people who were most directly impacted, those people who had AIDS or had HIV. So we, growing out of a campaign which was essentially negative, which was essentially to stop something bad from happening, which was a quarantine of people with AIDS. From that, we said, well, what can we do that positively impacts the person with AIDS and the care that they receive? And the impetus for it was we began to look at San Francisco and what was going on there, the type of care that was being provided to people with AIDS in San Francisco. And when we looked at that, we saw that it was so much better than here. And we said, well, why, if we can have this in San Francisco, why can't we have it in Los Angeles? And very specifically, we looked at the issue of hospice care. And we looked at the hospice programs, both in-home and residential hospice programs that were flowering in San Francisco. And meanwhile, in Los Angeles, we saw people who were dying of AIDS in the streets of Los Angeles. So we began by holding a public hearing, which got a lot of interest and a lot of participation by the community and a lot of press. And as it happened, it was held on February 16th, 1987, which was the day Chris Brownlee was diagnosed with AIDS. And his story and his travails, particularly at the hands of the county system, sort of informed the battle from the very beginning. He waited for 3 days on a gurney at County Hospital for a bed, side by side with people with infectious hepatitis and other diseases, with lights on 24 hours a day. And finally, I called up political contact I had and said, get him a room, get him out of here. And he was moved within a half hour, which only reinforced our feelings that if he could get out of there by virtue of a phone call, what happened to the person who didn't have clout? What was happening to that person? So if anything, it reinforced the crusade that we made out of the care of people with AIDS. And I think on a personal level, my involvement in AIDS comes to a large degree as a way of channeling many of my feelings: anger, grief, fear, etc. And I think that was particularly strong as a result of my relationship with Chris, who was one of my oldest and dearest friends. And what I saw in Chris after he was diagnosed was that he was really found himself in the battle against AIDS and in the battle for people with AIDS. And that was very, very inspiring. So very often, while I was kind of the organizational hammer, sort of pulling things together and activating things, he was very often sort of the emotional hammer. He got up before these audiences and said, I'm a person with AIDS, and myself and other people with AIDS need this care. It's your duty to provide us with the care that we need. And that was almost impossible to resist. And so over the course of these last 3 years, we went from being a small political action group to being a nonprofit foundation. We went from having 1 employee, myself, to having almost 100. We went from simply raising the issue of care to being one of the largest providers in Los Angeles County of that care. We went from emphasizing hospice to now covering the full spectrum of care from diagnosis with HIV through hospice. So it's really been a very, very interesting journey and a very, very challenging one.
This clinic that has just been opened by AIDS Healthcare Foundation is designed to provide comprehensive care for people with HIV disease. There are 2 programs in the clinic. The first program is called Richard Polanco Early Intervention Program, which is designed to provide medical care to people with early stages of the disease. The second program is called the AHF Medical Group Program, which is aimed to provide what is needed for people with acute problems or people with AIDS. Part of that program, the second one, is an inpatient service at Hollywood Presbyterian Queen of the Angels Medical Center. We have currently put together the 2 programs at our offices on the Hollywood Presbyterian Medical Center grounds, and we're providing both programs there. Eventually, these programs will be split apart and will be in 2 separate places. One of them, the first one, which is the Richard Polanco Early Intervention, will be in East Los Angeles, and the medical group will stay where we are now.
Nationally, as of the end of 1990, there were close to 160,000 diagnosed cases. Of those, about 63% had passed away, had expired. In Los Angeles County, we're one of the metropolitan areas with the highest incidence. We're one of the 3 highest. And I believe that our figures are somewhere in the area of about 12,000 cases. And in terms of mortality rates, it's pretty closely mirrored to the national figure, about 61 to 63%. Based on the statistics, I think that, as I mentioned earlier, we're only beginning to put a small dent in providing the level of the care that these people are going to need. Those statistics are actually AIDS diagnosed cases. If you take into account people with earlier stages of HIV disease, people with just HIV symptomatic disease, or people who are still asymptomatic, you're looking nationally at figures in excess of 1 million people who are affected by HIV. So obviously there's a greater need for facilities such as this one, where people can be followed from the early stages of HIV infection, when they might be feeling fine and functioning extremely well and living their lives normally for the most part, all the way to end-stage disease.
Right now, we have a very, very, very desperate need for volunteers in all of our programs. We have a need for monies. We need to subsidize the care that's provided, particularly to people without insurance. And we need people's support in terms of the legislation that we sponsor and in terms of rallying public officials and the media to our cause. We also have a very exciting new project to raise funds for the AIDS Healthcare Foundation, and that's known as Out of the Closet Thrift Store. We have one located in Atwater, and we have another one opening shortly in Hollywood. And that's a way for people to give just by cleaning out their closets. It's also a place where we need volunteers, and of course people can go there and shop.
This store is so good, huh? You find everything.
Everything you ever wanted, huh?
Everything.
What's your favorite so far?
This is cut. It's so gorgeous. Just let me try it on.
Yeah.
What do you think? It looks good.
I think that's you. So how do you like working at the thrift store?
Oh, I enjoy it very much.
Yeah? How long have you been here?
I've been here 8 months. 8 months.
Uh-huh. And are you working here full-time now?
Full time.
So I bet you see a lot of interesting people coming through here from time to time, don't you?
Yes, I do. A lot of interesting people, and the community has been very supportive.
My lover, 5 years, died. It was 4 years ago in December of AIDS. And it was, of course, one of those milestones in a person's life. So I was constantly looking for some way, a positive way of putting something back into the community, and also feeling as though I was helping out people who were less fortunate. He was one of those extremely fortunate people in that he had excellent health insurance, he had an excellent employer, and he never wanted for anything, even down to the companionship. But there are so many people out there that don't have those kind of opportunities and that kind of support system. And I really believe that we as a community of man owe that to each other.
My roommate was diagnosed about 3 years ago with AIDS. He lived 2.5 years with full-blown AIDS, and he wanted to stay home, and I told him I'd help him do that. And throughout the whole term of his illness, he was able to stay home till the last couple of days. And I wish I just would have known now, or I would have known then what I know now, all the things I've learned working here. But I decided after my roommate passed away that I was going to do something. I didn't know what or in what capacity, but I wanted to stay with the effort fighting this thing till it was gone and over with. And I read about Chris Brownlee Hospice, and I came to realize that this is a safe place to be with a lot of good, caring people here, all volunteer people, and it just felt like it was the right thing for me to do.
It's not a place where you come and you put in 8 hours and then you go home. When you leave here, you take part of you leave part of yourself here and you take part of them home with you. And it's very rewarding to see a patient, as I said, go to heaven and be out of pain. But it's also a big reward when some of them can recover and walk out.
What's great about working here is it's not like I'm just in the kitchen. I mean, this is the best thing I've ever done in my life, working here and being a part of this. There's no way to stay emotionally distant anymore like I did before. I'm completely emotionally involved in the care here, and in particular in a couple of the residents' lives. And it's hard. It's not like going to a normal job every day. It's very hard. In fact, I was actually very upset when I left here last night because one of the residents I'm really close to is getting sicker every day, very quickly, and it's really emotionally draining, but it's so rewarding.
When I first came here, I thought it was spooky. Spooky was the best word I could describe when I started. The best way I could describe Chris Brownlee when I first started working here, because it's like when you sign in, when you first get in the office, you're saying hello to everyone, you sign in, say what time you came in the door, and then the first thing you do after that is automatically, instinctively, check the front of the book where it has a list of names of people who have died recently, so you don't walk into someone's room and be surprised.
The most difficult thing a person has to deal with on a daily basis of going through AIDS, I think, is not knowing what the next day is going to bring, how they're going to feel. You know, am I going to be able to eat my lunch in 2 hours? You know, how am I going to feel when I wake up in the morning? I feel horrible now. Getting through that, just being sick on a constant basis, I think, and not knowing what's next, not knowing how you're going to feel the next day, really brings me to admire the people that battle this disease, because I have a cold for 3 days and I feel like crap and depressed and oh gosh, I haven't done anything. And here they deal with, you know, major battles of sickness every day, every week, you know, something different all the time. And that to me is really courageous.
Anger, I'm still trying to focus, where to focus that anger about AIDS. I'm not sure, you know, I don't know if you can't put the blame on any one person or one situation, and I'm still dealing with that, and I wish there could be one spot where I can look at and be angry at it or focus on it, but I can't do that. I don't know yet, you know, where to look or who to blame, so I'm just applying my loss working here with the other people.
Well, I think the potential exists for AHF to become the largest provider of AIDS care in Southern California, and I think that brings with it opportunities for re-examining how healthcare is structured. And at the same time, I think it brings with it risks. By taking over the job of providing direct medical care to people with HIV and AIDS, we're assuming a terrific responsibility. And we have no assurance yet that the resources will continue to be provided for that. And I hope that whether it be the county or the state, will not absolve themselves of the responsibility. We spent many years fighting to improve the care at county facilities with only limited success. And now, because the people that we love and because of the people who we care for in our facilities have no other alternatives, we are taking up the challenge, as we did with education, AIDS education, and as we did in AIDS hospice care, of getting into this medical area. But it is an awesome responsibility, and it is very, very, very costly. So it's going to have to be a partnership between government, between the AIDS-affected community, and society as a whole.
You have to have a loving heart to work here.
Saying goodbye is probably the hardest thing I have to do. I have a problem doing that with people who are living. They're the mothers that have nursed these children back to health out through all their childhood illnesses, and so families have a hard time letting go. And then you have the significant others, or the lovers who this is the person that they've chosen to love, and it's hard to turn loose of these people. Very hard to turn loose. I have probably seen well over 300 deaths here at Chris Brownlee. It's a devastating amount.
If I can summarize my time here at the Chris Brownlee Hospice, especially dealing with families and friends and the people dying of AIDS, I would say that there is no suffering, I think, on the planet Earth that is most profound and challenging as a human being dying of AIDS. Working here at the Chris Brownlee Hospice for the last 9 months, I have witnessed and journeyed with around 130 people dying.
I just feel that God had me here for a purpose. I can be somewhere else making more money, but I feel like I'm here, I'm needed. I wonder sometimes how come I keep smiling. I don't know, sometimes it's real hard. But that's the only way to go on in life is to keep smiling. Like Victor, he keeps me smiling all day. I don't know why. I have seen numerous residents died. I can't recall how many, but there have been a lot.
The public should be more educated, and parents should be more open with their children about sex. And I think it's finally getting to the point where AIDS is not branded as a homosexual disease anymore. And there was this lady sitting next to me, and she said, I haven't seen you in a long time. What have you been doing? So I told her. I was all excited about it. And she moved one seat away from me. And I asked her why. She says, well, you might have AIDS too since you're working down there. So I had to get a little nasty in order to get it through her head. I said, I'm not worried about getting AIDS working at the hospice. The one that should be worried about the AIDS is you. How many men have you slept with in the past month? She walked away and called me all kinds of names. Victor's a nice kid, full of love. Mainly that's what they need, a lot of love. It doesn't matter whether they're gay or straight. The thing is, if they get AIDS, they're going to die. In the past 7 months that I've been here, I've never seen so many people die.
At Chris Brownlee, I work with people in allowing them to express themselves and where they're at. In support group, it's supporting them in the decisions that they make. Some of them already have made their life and death decisions when they get here. As far as residents, sometimes they're making those decisions when they arrive. So it's sitting down and listening to them and hearing what they have to say as far as what they anticipate their next level to be, the ultimate being death. When my best friend in Arizona was kicked out of a hospital because he had some disease that they didn't know what it was, and he had no home because he had been in there so long, and I brought him into my home until his death, not realizing that he had AIDS, because 8 years ago they didn't have a name called AIDS. There's over 100 people that I've sat and assisted as they went through their last breath.
One of the things we know is that right now, 83 or so % of AIDS is pretty much embedded within the gay and bisexual community. That's changing. We want people to start looking at high-risk behavior instead of high-risk groups. And one of the most poignant stories I can relate to this is that a friend of mine who goes around to college campuses and educates people, he lectures and basically does AIDS 101. At the end of one of his lectures, 3 young men, athletic, well-built, handsome young men, came up to him and they said, we're HIV positive, and none of us are gay. We don't have high-risk sex. We don't have anal sex. We don't do any of these things. But we're all HIV positive. And after questioning them for a long time, he found out the source of their HIV positiveness was from sharing needles for hitting up steroids. We fight to make people aware and understand that there's an epidemic out there. People just don't get it into their head that women are the classic and most vulnerable receptacle for AIDS. I mean, a vagina is this warm, moist area that when it's injected with semen that has HIV in it, it grows incredibly and beautifully fast. Women are the most at risk right now of anybody. I've nursed to their death 5 people.
My family is very happy that I've made that decision, that I'm no longer living alone, and that I'm in a situation now where I'm with people and in a place that's safe for me and around people. Chris Brownlee provides that. The worst thing about the HIV virus is not knowing what's going to happen next with me physically. I've already experienced some serious physical circumstances while being a resident here, and I don't know what's going to happen with me, with what physical part of my body is going to be altered or cause great harm to me.
In 1990 of September, I found out I had the AIDS virus because of my surgery of 1982. I did not drink, I did not do something wrong. I did not smoke. I did not do drugs or anything. God has a purpose for each of us. And the reason why I still fight for the survival, for my survival, is that God has a calling for me to be a mother, to be a family woman. Because of my child, I would like to have more time with her and enjoy her childhood. And this I would like to accomplish. Thank you, Marcel.
We share our lives, and it's a community. And I've never had that before. It's amazing how grown adults can be so danged ignorant about how you catch AIDS. No, you cannot catch it from a doorknob. Body fluids, that's it. If you're not educated, you could easily get it yourselves. Monogamous or not, you can get it yourself. Know what you're doing.
I have a family. My family is my wife, Fabiola, the name Fabiola. I have 3 children. I have a daughter, Ana Maria, 17 now, and Giovanna, I got a 15 now. And my little baby, 1 year and 21 months now. My wife, yes, I have infection. My wife now is just complicated now, you know why? Only working me, you have the Social Security now. Living for Social Security is a big problem.
The doctor came in one day. He said, "You want to go to the hospice?" I said, "What's that?" He goes, "Well, it's like a little hospital, and they do therapy on you and stuff." I said, "Yeah."
I think that people don't understand how they think. So many people say the hospice is so depressing.
No way. It's not.
It's like, how could you work there?
depressing.
They always say to me, how could you work there? It's so depressing. But my insurance job was depressing. That's why I used to be an insurance auditor for 7 years, and that is depressing. This is not depressing. I'm very happy.
No, this is
working here. It's very
very
rewarding. It's very loving. The staff, we're all like a big family.
Everybody cares about everybody.
None of the deaths have been the same. They've all been different. But 98% of them have been comfortable at the time of death.
Every time